good things and you. Healthy in Utah.
Being healthy in Utah includes wearing face masks, practicing safe physical distancing, staying home if you're sick, and staying up to date on preventative care.
So if you were watching Good Morning America this morning, our state making national headlines along with several other states this morning about having extremely high COVID-19 hospitalizations. So this week, Utah doctor Todd Vento from Intermountain Healthcare sat down with the anchors on Good Morning America, and they were asking questions about our state, which was interesting to see if you're watching on a national level that he's right there talking. This was the first question they asked. They said, what does that mean, those high hospital occupancy rates for other patients here? Take a listen.
Well, in the concept of that capacity also just talks about the bed numbers. It doesn't talk about, what that strain puts on individuals who are doing extra shifts or working past their shifts and things like that. But what it also means is that we can't, at some point, we get to the point where we're not delivering care to the same quality or same standard that we could be. We've had a very low case fatality rate or ratio, a death rate in Utah in particular, and that's great. But as we get more cases, we can't provide the same level of care. Therefore, what you can expect, and we see in other cities early in the epidemic, that the case fatality ratio will go higher. The patients will have more severe illnesses, and that's what we're very concerned about.
And rightfully so. That is definitely a concern in our state right now. Good Morning America also asking him about Governor Gary Herbert's statewide mask mandate and the curbing of the social get-togethers over the next 2 weeks. They asked Dr. Vento if he thinks that will be enough.
Seeing that our spread in our community has come from social gatherings in particular, maybe extended family, et cetera, that's where we're targeting this pause in social gatherings, extracurricular activities, hoping that that will make a dent in that part of our epidemic that's causing the increased recent surge. But I do believe that we may very well have to go to stricter measures if we don't see the decrease in cases very soon.
Yeah, and I think a lot of people watching that saying, okay, what does that mean for Thanksgiving? What does that mean for the Christmas holidays? But Brian, I know you've been talking about it on Good Morning Utah. We're in a serious situation in our state right now.
And you have the governor saying that there's some of those aspects of those policies may be extended after the 2 weeks. So as of today, right, they end on the 23rd, so Monday, that week of Thanksgiving. And there's a big question, is the governor going to extend some of that where you can't get together with someone outside of your household on Thanksgiving? I think a lot of people waiting to see kind of what he does there.
Well, a lot of these health experts are saying it's about time that we have this mask mandate because the hospitals have been, they see the writing on the wall long before that press conference, right?
Cases climbing and climbing.
Well, they're in the hospitals, they're in the emergency rooms, in the ICUs, and they're seeing patients. And I remember a lot of these nurses also telling us once they have the beds clean, they already have someone coming in, and that is a scary feeling. And when that happens day in, day out, they worry, and they worry every minute of the day.
It speaks to what he said, it's the level of care. How can you keep providing this level when you're right? It's just rotating beds.
Well, and the
right
level
now.
of care in Utah is exemplary.
Yeah.
We do have incredible care at our hospitals and at our everywhere we go to the doctors. So I know it's frustrating. It's frustrating for the nurses and for the doctors. It is.
The fatigue that everyone's
they're
feeling.
exhausted. Exactly.
They've been exhausted for months now, and also the anxiety from day one in March. And so they're continuing, and now they have to ramp up even higher because our cases are so high.
And Brian, daily cases even yesterday did not take a dip, did they?
We're talking about 2,500 cases
Yes,
on
a
average here in our state. And you remember that was not long ago we had 400, maybe
Right.
500 was
which
the goal.
allowed us to open our schools back, right?
And here we are still in school, and there's a lot of teachers there, especially the teachers union here in Utah is questioning whether or not that should be the case with our schools.
So we're talking about quarantining, right? And if you are quarantining for Thanksgiving, today marks the day that you need to start, the 14 days before Thanksgiving. Here are some ways, and the 2 weeks starting from when Governor Herbert talked, that brings us to the 23rd. So if you are having a small gathering, here are safe ways you can do it. You can still do it virtually, and again, start quarantining today. You can bring your own food, drink, and silverware. Wear masks and stay that 6 feet apart.
It's
while
those little
eating.
things you've never thought about, and now you're like, I could bring my own knife
I
and
know,
fork and
I know.
spoon to Thanksgiving. Yeah.
Well, and really quickly, there's outbreaks of the virus, 14 schools in the Jordan School District moving to online learning. We will put those on, I heard you talk about them this morning, Brian.
Yeah, we have that online too, so you have the whole
We'll put those
list
on our
right there.
website. I mean, you probably already know.
a lot.
Huge
If your
amount.
kids are going there, that's
Yeah.
a lot of schools. Yeah.
And 4 in the Davis district too. So you've got a number of them right now dealing with outgoing outbreaks of the virus.
Yep.
All right, so today, if you want to quarantine, get together, today's the day. Healthy in Utah is all about supporting healthy choices and boosting Utah's economy. It's for everyone who stands with Utah business. Up next, we are honoring all of those do-gooders. Utah, so many wonderful people. We want to recognize them next.
All the great volunteers we have here in Utah. And still ahead, put the spark back in your relationship. Hear about a breakthrough treatment that can help. And in our second hour, do your kids like doing projects at home? We'll see how to make your own dipped pumpkin.